Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls right here, right now, 866-870-5752. That's 866-870-5752 right here in the studio. You can speak with Dr. Darrow and get his latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. What do you think?
So I'm living it up. Dino, stick with us. We have a caller waiting, Dino, who's talking about his father's shoulder. His father's 90 years old. Before I get back to you, Dino, you're a great caller, by the way. Thank you. I want to just mention a few other things. In the office, we also do what I'll call face regeneration. We inject stem cells and or platelets into the face to grow back the collagen in the face and make people younger looking. It's a pretty simple procedure. And we also do that for hair regeneration. If your hair is thinning, it works. If you're Dr. Phil, it ain't going to do much. So, I know. I love when I say that because it gets such a great laugh out of you, Nita.
Oh, God.
So
it always surprises me.
So what is regenerative medicine? Very simple. We regenerate tissue in the body that's been worn down, arthritic, torn, you name it, and it works on the musculoskeletal system. I don't treat diseases. I do orthopedics, though. I was trained at UCLA in what's called physical medicine and rehabilitation. I started out my training in orthopedic surgery. I did a lot of surgery in my training. I loved it. And then I had a bad shoulder surgery, and it shifted my course for my whole life of the work that I do. And after a bad surgery, not a bad surgeon, let me say that, a great surgeon. I loved the guy. It just came out bad. You know, there's a lot of human error that takes place in surgery. There's a lot of things during surgery that we call ectopic. That means things are not where they're supposed to be in terms of what we think. And an example of that is so crazy, you won't believe this. During my first med school examination, it was a clinical examination, and we had a giant clinic with a lot of rooms, and we go from room to room, and in the room would be a patient with the doctor sitting next to him quietly, and we would have to examine the patient and then decide what was going on with the patient. So I walk in a room, there's a gentleman sitting there, and the first thing I had to do was listen to his heartbeat. So I take my stethoscope and I put it where the heart is supposed to be, and there's no ticking. I hear nothing. I'm so confused. I move my stethoscope around and I hear nothing. And I am freaking out. I'm like, I am so dumb, I don't even know how to listen to a heartbeat. And then I had this thought, maybe this guy's heart is not where I've ever heard a heartbeat before. So I started moving the stethoscope around. Guess where his heart was, Nita? You're smart.
On the right side instead of the left side.
You got it, baby. That's why I like you on the show. He had something called situs invertus.
Wow.
His organs were reversed. I was the only one out of my med school class that happened to luck into finding that. And I got an A on the exam. And just by luck, really. So we have to be very careful in examination and finding out what is actually causing problems. And I forgot where I started from with that long story. Do you remember, Anita?
Yeah, because you were saying ectopic.
Yeah. So in surgery, there are times when we go in and things are not where they're supposed to be. Actually, that happened to me another time in anatomy class in med school. My anatomy teacher was very tough, and she would stand at each cadaver table to intimidate us. And I walk to one of the tables, and she goes, "Where is the thoracic duct?" And I'm like, "Well, I don't see it." And I'm digging around with my hands. I don't see it. She goes, "Right." And she slaps a scalpel in my hand. And she goes, "Go find it." And it wasn't where it was supposed to be. I had to dig around. She used to trick us all the time.
Well, that's how you learn.
Well, it is. I mean, we used to literally sweat when we'd have an exam with her because she was a great teacher, and you're right, that's how you learn. But it was very intimidating. Anyway, we have to be careful, Dino, with your dad, that we don't get in there and operate, especially on someone 90 years old. I mean, I don't think that's that old anymore. I treat tons of 90-year-old people in their 90s, tons of them. I treat tons of youngsters too, and everybody in between. So age doesn't have much difference in terms of the healing, although I hear it all the time. I read it on the internet. You can't use these cells are better than those cells. It's harder to heal someone older. They don't heal as well. I don't find that to be the case. I have a woman who's 95, and I did her right shoulder about 2 weeks ago, and her son brought her in, and I saw her, I think it was Thursday, just a few days ago, and she's hard of hearing, so it appeared that her right shoulder was healed because she wasn't complaining about it, but she was complaining about her left shoulder. So it's like, that's a win. A lot of times what happens when one part of the body heals is another part will show up that really was always painful, but it wasn't as painful, and the brain picks out the one that's the worst. Dino, I'm going to give out the phone number, then I'm going to get back to you in a second. Give me a call right now. I'm going to send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. There is a foreword by the beautiful Suzanne Summers, who's a great advocate of my work. She wrote the preface, the introduction to that book, and another book called A New Way to Age. That's her latest book. There's a whole chapter. It says Interview with Dr. Marc Darrow. It's all about stem cells and platelets and her experience with it. I've treated her many times and her family, and all with amazing success so far. And I'm very grateful to have you as my friend, Suzanne Summers. You're an amazing person, a great magnetic personality, great healer. She helps so many doctors learn how to heal naturally. So I am very enthused and very excited to have you as my good friend. So Dino, what else you got to tell us? We're here. Our ears are open.
Yeah, I think I'm good, Doctor. I think you explained the situation very clearly. Thank you very much.
Okay. Well, God bless you. God bless your father. And make sure that he doesn't have an unnecessary surgery, because it is true, though, as we get older, the organ systems don't work as well, and it's hard to recover from a surgery. And doing a shoulder surgery on a 90-year-old, to me, is major surgery.
Sure. Well, I do have a question then. If you had a steroid shot,
yes,
how soon thereafter can you get a treatment from yourself? Does that have to be a space of time to pass for that steroid to kind of wear itself away?
That's a good question. There's no scientific answer to it. I've never seen a study on it, and I haven't done a research project on that. But my experience is if I wait several days, people will heal. It still works.
Okay.
Yeah, it's not like you have to wait a long time.
You,
yeah. All right. God bless you, Dino. It's been great talking to you. You gave us a lot to talk about, and God bless your father. And there is good hope that he can get rid of shoulder pain using stem cells and platelets, what we call regenerative medicine, growing back the tissue. The phone number to talk to me live right now, I see we have callers coming in. And we have a few minutes left in the show. So the number to reach me live right now is 866-870-5752, 866-870-5752. If you call in, I'm going to mail you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. That's my point of view. If you want to operate, go ahead and do it. I won't stop you. But my point of view is try conservative things first. So should we go to Daniel?
Sure.
Okay, so your mom, Daniel, has hip and knee issues. How old is your mama?
Hello, doctor. Yeah, she's 73.
70. So she's young.
Yeah, she's actually turning 74 today. Yes, sir.
Congratulations.
Thank you.
Tell us what's
The
up.
reason I'm calling is because she's had like 6 back surgeries, and then through that, she's had a lot of problems with her hip, and they just did an MRI on her hip, and they were saying they showed us how it's bone on bone, and
Okay.
with her knee, it's also on the patella, it's bone on bone,
Okay.
and so yes.
Let me ask you a couple questions about that. So this is the thing
Yes,
that I talk about in every show. All I hear is bone on bone, bone on bone, bone on bone, bone on bone. Okay? I hear it from almost all my patients, and that have joint issues. And then I examine them, and they have good range of motion, and a lot of them actually are almost pain-free. That's not bone on bone. The way I describe bone on bone is if you take 2 bricks, which are porous, and they're lumpy, and you try to rub them together and they don't slide, that is bone on bone, because bone is porous like that. And if it is bone on bone, the joint's not going to move. Okay? So the hip, can your mom walk?
Extremely painful, like
Okay.
slow.
Slow, but can she move her leg at the hip joint?
Very little. Very,
Okay.
very little.
Okay. Have you ever tried to move her leg to know that it's little, or you just watch the way she walks?
Yeah, the doctor did, and she just was screaming, pretty much in pain.
Okay. So that could mean that it's just painful, and it may not even be the hip joint. There are surrounding structures also, and ligaments that cause pain around the hip. It could be the greater trochanter, which is close to the hip, where there's a lot of muscles that attach. It could be many things. I would have to touch it myself to know. I have to do the examination to give you my hit on what's going on. What about the knee? Does her knee bend?
Her knee, it's the same thing as her hip. Extremely painful.
Painful,
Very,
but I
very
get
little.
the painful part.
She can barely move the knee or hip.
Okay.
Any movement
Yes.
causes extreme pain.
Okay.
But there's so she barely moves. She only moves it if she has to go, say, to the bathroom. And that's pretty much it. She spends the time about 95% of the time in bed. The less she moves, the better it is for her.
Oh my God, I'm so sorry. That's sad. So I'm going to give you an analogy here. A lot of people come in with arthritis in the shoulder, okay, and they have also concomitantly at the same time something called adhesive capsulitis. That's what we call a frozen shoulder, and we can fix the frozen shoulder often, and then we find out that the arthritis was not limiting the range of motion. Okay, so there can be a mixture of different syndromes or diagnoses, and until I examine your mom, I'm not going to really know what's going on. Just because I hear bone on bone does not impress me, because I hear it all day long when it's not true. That doesn't mean your mom doesn't have bone on bone. She may, but I wouldn't know unless I do an examination. And unfortunately, I don't trust traditional medicine. I wish I could. I was raised in it. Family of doctors. Thank God my grandfather, who was born in the 1800s, was a doctor who didn't like surgery. So I learned, alternative things from him. And, I'm going to just say this. It's not a nice thing to say, but I'm going to just say it because he said it when he was a very trusted doctor. He said, don't go to a butcher. So I say be careful when you go to a surgeon. I don't call them butchers. I call them the brightest guys in medicine. It's just that a lot of the surgeries that they do have been proven with their own studies not to be needed. And that if you do, there's studies that show if you do a fake knee surgery versus a real knee surgery, okay, the fake ones do just as well or better than the real ones. And the real ones can have a lot of side effects, infections and taking tissue out so it decompensates the integrity of the joint and then gets you ready for another surgery or a knee replacement or whatever it is. So I'm not convinced anytime I hear a diagnosis from another doctor who does traditional medicine until I do the examination. So I don't know about your mom. I'm talking conjecture, maybes, but the maybe part is that there is a possibility that she is able to be healed, okay, without surgery. And I wouldn't know unless I examined her.
Okay. She is, at this moment, this week, she had her, she got done an orthovisc shot, the first of 3.
Right.
And then the next step is what we're talking about is having either a PRP or stem cell added to that as well.
Okay. All right.
And I just been doing a lot of
you're looking in the right direction because you're going a more conservative route, by doing injections.
Yes.
So let me tell you about orthovisc, not personally in terms of that medicine name, but orthovisc is hyaluronic acid, okay?
Mm-hmm.
Which is a lubricant. And typically when I see patients who come in, they go, yeah, I've had hyaluronic acid several times. It worked a little bit, and now it's not working anymore. A lot of times they'll come in with a knee full of fluid, and I'll say, why would they put hyaluronic acid in your knee when it's all full of hyaluronic acid? The body produces that naturally. And when you do regenerative medicine, platelet stem cells, there's even more hyaluronic acid that's produced naturally. So I don't know why any doctor, just that's me. I'm not saying it's the devil. I'm just saying I don't know why any doctor uses hyaluronic acid. And I'm going to tell you a sad story. For me, I injected some into my left knee, and it swelled up. And the swelling is still there. After it happened, I aspirated it out. I do all these injections myself. I aspirated it out. I use an ultrasound to do my injections so I can see where the needle goes. The swelling is starting to go down, but there are certain people that are allergic to these things. So you have to be careful with them also.
Okay. The doctor that I found for my mom is out here in Orange County, and he takes care of a baseball team and a hockey team from out here, a pro team.
Good.
And so that's why I went to him, and his next suggestion would be the PRP after the orthovisc.
Okay,
which is we're going through this process trying to see if it does work.
So let me just give you my 2 cents. You don't have to do it, and every doctor does things the way they want. If I was your mom's doctor, first of all, is her doctor now an orthopedic surgeon?
No. If there's surgery needed, he's going to recommend that. He doesn't do surgeries.
Good. So that's number one. That's really important. You don't go to an orthopedic surgeon to get PRP or stem cells. Okay?
Exactly.
It's just like you're not going to go to me, who does physical medicine rehabilitation, to get surgery. Even though I've had a lot of training in surgery, that's not what I do. So I think your mom's on the right track. And, the conservative route is important. But make sure that she doesn't give up, because I've had parts of my body I've injected where it's taken a lot of times of injections before I've healed. I've had so many patients who have, quote, bone-on-bone arthritis who don't want surgery that we have helped heal by doing a lot of regenerative medicine on them.
Okay.
The surgery always seems like an easy way out, but then what you get out of it can be terrible. It's It's like going to Las Vegas as far as I'm concerned. Some come out great and some come out terrible.
Yeah. Yeah, she's had about 6 back surgeries, and it's just escalated to so many different things. So it's painful and really hard to watch. And I'm trying to do everything I can to help. So. Well,
God bless you, man. That's good for you, Daniel. Is she better after her back surgeries?
No.
Okay. Well, there's what I'm talking about. That's what the show is all about. 6 back surgeries. Yeah, exactly. Can you imagine that? I can't even imagine one. They're not fun to go through. I have patients all the time coming in with failed back surgeries. You know, I don't know if you know this, but insurance companies have a diagnostic code, failed back surgery. Do you understand what that means?
No.
It means there's so many failed back surgeries that they have to have a diagnostic code. You can't get a diagnostic code easily. You know, I had a surgeon on my show one time, who was a back surgeon, and I said, "What's your success rate?" And he said, "I'd guess probably about 50%." He said, "I don't do back surgeries or neck surgeries unless I have the patient and the family come in 3 times to convince them not to do it."
Wow.
This is not a put down on surgeons. Please understand that. I say it all the time. They are the hardest workers in medicine. Their work is dangerous.
Yeah.
Nita and I heard about, I don't remember when it was, a year and a half ago, a woman called up and she was crying on the radio and said, "What happened to my husband?" And I said, I don't know what happened. What happened? He came out of a neck surgery on a ventilator. You know what a ventilator is?
Yes.
Yeah, he couldn't breathe, the breathing machine. And I said, "Well, honey, I don't know what happened. Why didn't you ask the surgeon?" And she said, "I didn't get a chance. He walked in the waiting room where I was, said I did a perfect job, and walked out." That poor guy died several months later. They stuck him in rehab, and he died. So I'm not big on surgery. I'm just, don't come to me if you're thinking about surgery. I tell patients, a lot of patients come in, they go, "I'm thinking to get a surgery." I go, "Well, you should leave right now because I'm going to tell you not to do it probably." There are cases I refer for that, but it's very, 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 very rare. All right,
Okay.
Thanks a lot, Daniel. And if you want to get a hold of me at the office, the phone number is 800-300-9300. You can go to the website and email me from there. It's www.lastemcells.com. Nita Valens, thank you so much. Suzette, Alex, and the crew, God bless you all.
And remember to listen to our pal Warren Eckstein from 11 to 1 every Saturday on The Pet Show. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.